So it's the actionable data, it's the infrastructure, and then it's, well, we can be entirely successful. And each agency could build an excellent program. And it would not succeed unless the PEBB and the health plans step up and do their part. So it's the integration that needs to happen. So we're doing our part, creating our side of the partnership. And the good news is that PEBB is taking notice and are starting to do their side of the partnership. So as you look at this data, think actionable data. How do we begin to build that infrastructure in our agency so we can take action? With that said, if you look on the page that has 2 boxes, and you look at the one on the lower right-hand corner,
What's the title on here?
it is called Eliminating Risk Factors. I think that's an important piece. These are essentially the early adopters, the people who got data, the people who said, I'm going to change that, and they did. And that there's always those folks in an agency, and we are happy for them. And I would like to be one myself sometimes. So what you find is that there were quite a few risk factors eliminated in your agency. And what the national data says, actually it's Eddington data, is that 1, cost follows risk. So as risk is reduced in a population, the cost of the population follows that. If risks go up, the cost follows it that way too. And as Mary's point, or I should say the ESD team point, the productivity is where we really need to focus. The data is the same. As risks go down, productivity increases or gets better. And as risks go up, it goes the other direction. So if we're seeing, with really very few intervention programs, some reduction in risk, we're on the right track. And then on the back page is the measure that we at this point have chosen for productivity. And I'll give the same caveat, is that we don't have a comprehensive program yet. You don't have a comprehensive program yet. We're just getting started. You do not expect to see these improve. In fact, it looks like overall that it got worse.
Can I just, I'm sorry, the legend did not get on. So let me explain. The blue line, is that the first line?
Yeah.
The blue line is June. The red line is December.
Right. So you have yours for your agency. We have for the entire population. The reason that we put this into the screening is that we want to learn how to work. This is the most widely used tool, and it's the one that appears to have the best relationship between capability, health-related ability to do your job, and the health risks.
Scott, sorry, the measure is productivity loss, so higher is worse. Is that right?
Yes. Yeah, that's a good thing to say. That productivity loss is the measure, so if it gets higher, that's worse.
And is there an explanation of what these mean, including what's WLQ, for instance?
Yes, we've had one session, and we will have more. Excellent question. What does this mean?
Right. What am I looking at relative time scale?
Right. And we do have, is it on the, where's it posted?
In your packets, on the comprehensive and follow-up surveys, the last 6 questions are the questions that relate to the work limitation questionnaire, which is what the answers you're seeing. And then other than that, for resources, we have a take-home call from Deborah Lerner out of Tufts, who explained the WLQ to us, and some other, just a couple of other pieces in the VO. What we did learn, as we're learning about the WLQ, is that it is a comparative sort of thing, and I'm not really sure 6 months is a fair, sort of comparison.
Right.
I think they do them yearly.
Yeah, one, again, we don't have a comprehensive program, so we wouldn't be looking at big changes here. And secondly, what happened between June and December? Didn't the economy just fall, right? So I think there's some other factors.
Yeah, just another factor to consider is we went from summer to winter. And
Excellent.
I know that impacts me.
Mhm. Many factors. So we're learning about this. So this is here to help us begin to learn. And we did have one teleconference with Deborah Lerner, who was the primary author for this. The WLQ's been around about 15 years, and there's lots of data behind it. And she continues to collect data and to develop it. We had one teleconference, and we will have an additional teleconference, and we're inviting your senior leaders. And Deborah Lerner will have time then with them, where they will have time with her to ask questions, to begin to understand what does this mean, why is it valid, how do you use it. So with that, I'm going to leave you with your data, look at it, and Kathleen will plan a teleconference. What do you think?
Yeah, I think so. I wanted to point out one other group of data that we didn't have last time. We actually have it from the biometric screening one. But thanks to, where's Lydia? Where are you sitting, Lydia?
Right over here.
Oh, just so quiet. Lydia is, again, from the University of Washington, and she's really assisting in the evaluation. And she and I worked together to put together a more composite picture of people at risk for diabetes and people at risk for high cholesterol. Because we were just using a fasting blood glucose of greater than 100, and for people who really know diabetes, that really isn't, that doesn't really tell the whole story. Same with cholesterol, we were using people greater than 200, that's what we're going to reduce. So in the thick packet, unfortunately, sort of wedged in between are some graphs around those risk factors and how many employees had each of the risk factors for diabetes, which is pretty cool to look at. It is all of HWI in cohort 2, so it is not agency specific. Some of you may have enough people to be able to provide that data. Most of you do not, because we would be breaching confidentiality.